All right, well, good morning and good afternoon to everyone here live, and also hello to everyone watching the recording after the event. My name is Francis Shen. I am a law professor at the University of Minnesota Law School, and I also have the pleasure of co-leading, along with our two guests today, and Tu Huang, an NIH Brain Neuroethics grant called Improving Recruitment, Engagement, and Access for Community Health Equity for Brain Next Generation Human Neuroimaging Research and Beyond, known by its short name, REACH for Brain. This is a really exciting project that, as we'll talk about today, is utilizing community engagement strategies to co-create evidence-based solutions as well as ethical guidelines to expand the inclusiveness of participation in NIH brain research and especially neuroimaging studies. I want to thank NIH, National Institute of Mental Health, and NIH Brain for their support. And anything we say today are our own views, not those necessarily of the NIH. And you can find more about this project at reachforbrain.org, and I'll put that in the chat as well. We have two presenters today. I'll introduce both of them and then hand it over, and they'll be running the show. There'll be time at the end for questions, though if something is really burning or clarifying questions, pop it in the chat. But otherwise, we'll do questions at the end. All right, our two speakers, I'll introduce them together and then hand it over. First, I want to introduce Helen Hemley, who's a co-I on Reach for Brain and is founder and the administrative and policy principal of Crescent Advising LLC. Prior to Crescent, she was the administrative director of the CARE Research Center Community Engagement Coordinator for NIH All of Us Research Program in New England and Communication and Community Health Council Administrative Lead for the Department of Medicine at Massachusetts General Hospital. As we're going to hear today, she's a real innovator in the area of community engagement in scientific and biomedical research, and we're going to learn a lot more about theories of change and outcome maps. Her expertise is on implementation of public and community health models into clinical research infrastructure and community engagement strategies for engaging especially historically marginalized communities in research. So thanks, Helen, for being here, and welcome. We're also going to be hearing from Dr. Jonathan Jackson, a PI on Reach for Brain and a founder and research principal of Crescent Advising, as well as an assistant professor in neurology at Harvard Medical School. From 2017 to 2024, Dr. Jackson founded and directed the CARE Research Center within Massachusetts General Hospital's Research Institute, and CARE worked to better address representation, diversity, and inclusion in clinical research studies. Dr. Jackson is also a cognitive neuroscientist who's investigated the early detection of Alzheimer's disease, particularly in the absence of overt memory problems. He has worked with many underserved, underrepresented communities and organizations. We've had the pleasure of working on multiple projects together, and has written really a lot in this area, especially not just for academic communities, but for communities and for leaders as well at the local, state, and national level. So it's really a pleasure to have both of you here. I'm excited to learn more about all of your work, and I know our audience is as well. So I'm going to spotlight both of you. Who's going first, actually?
I'm going
Dr.
first.
Jackson. All right. The spotlight Dr. Jackson first and hand it over to you. Thanks for being here, both of you. All yours.
All right. Thank you so much for that really, really kind introduction, Professor Shin. So hello, everyone. I guess good morning or good afternoon, or perhaps good evening to some of you. We are going to be talking about the concept of engaging the community in neuroscience research. And I want you to be aware that that term, community, is going to be doing a lot of heavy lifting in today's presentation. So depending on what your background is, your previous affiliation or association with research, especially neuroscience research, you might think of that term community in lots of different ways. And so it's my hope over the course of the first half of these talks that I try to touch on multiple meanings of that term. And hopefully there's going to be a little bit of something for everyone. So I'll speak for about 15 to 20 minutes, and then I'll turn things over to Helen Hemley, who's the co-investigator on the Reach for Brain grant, which will, and she will really focus on a very, very innovative way of community engagement and how that can be a great blueprint moving forward for neuroscience research. So just a quick disclosures. It looks like a busy disclosure slide. It's not. I just wanted to make sure that folks know where my research funding is coming from and where it has previously come from, and as well as the funding sources for my community work. So I wanted to start with a clip here, a video audio clip. And the reason why I want to start with this clip is because we have to recognize that those of us who do human subjects research, especially those of us who work as cognitive neuroscientists or human systems neuroscientists, or maybe clinical neuroscientists, need to recognize and remember that the way that we are viewed in the public is not necessarily the way that we think about ourselves as researchers. So this is a clip from an old PBS Nova special from 1993, so quite a number of years ago, that talks about sort of the scientist's view of the infamous Tuskegee syphilis study, which of course was conducted by the U.S. Public Health Service from 1932 to 1972. So this is just a very brief clip where they interview one of the last living scientists of that study on his views. And hopefully everybody can hear the video and audio. If you can't, I'll summarize things at the end.
Jonathan, I can't
Yes.
hear.
Okay. Let me
can see the video.
Yeah, let me try stopping and I'll reshare because sometimes PowerPoint really likes to have a couple of extra things selected on Zoom. So one moment. I'll try it again, and if it doesn't work, it doesn't work. All right. Here we go. Let's try that again. And hopefully you'll be able to in this particular video. All right. And let's try one more time.
One of the few surviving public health service doctors who worked on the study still defends that decision. John Cutler.
It was important. They were supposedly untreated, and it would be undesirable to go ahead and use large amounts of penicillin to treat the disease because you'd interfere with the study.
Okay, so for those of you who maybe didn't quite follow everything that was being said by Dr. Cutler here, the overwhelming feeling is that for 400 of these African-American men in Alabama, even though a cure for syphilis was readily available, very easy to administer, there was no need to potentially treat them because it would interfere with study goals. So that's some pretty evil sounding stuff. And unfortunately, if you look around in pop culture, if you look at cartoons or movies that feature scientists, usually this is the kind of view that we're up against. And unfortunately, it's one of the few just the Tuskegee syphilis study. There is a huge a list and of nefarious doctors and researchers who have done a ton of work to try to understand how far you can push human individuals, and for reasons that are, again, very, very hard to defend or justify in this day and age. And this goes so far that if you look at the bottom of the screen there, you see that at the Nuremberg trials, which were the trials of the Nazi war doctors, their principal defense is that they were not as bad as American researchers because they only experimented and operated on prisoners of war, whereas folks with the same training as many of us on this call conducted our research willy-nilly on an unsuspecting public. So again, we recognize that there's a little bit of a difference in perception between the work that we do as we share with we share with each other as colleagues versus, again, that public perception. And when it comes to neuroscience specifically, I think one of the earliest examples of where this kind of goes wrong, especially for folks who study the brain, is, of course, phrenology. So I'm going to assume that most of you on the call are relatively familiar with the concept of phrenology, but for those of you who aren't, it is a fairly what seems to be a laughable idea now to study the lumps in the on the heads of individuals to understand their abilities to think, their traits, and their virtues. And so you can see here By looking at the lumps in a certain person's brain, you can understand things like friendship and imitation and hope and self-esteem and firmness. And what's interesting about this idea is that we know now that there's not really a lot of substance to this idea of phrenology. However, we also know that while it seems a little bit laughable and it seems pretty innocent and it seems really easy to dismiss, we also recognize that phrenology was used for maybe some less than savory purposes. So it was a way of potentially characterizing and demeaning women. It was a way of kind of characterizing and differentiating sort of higher class from lower class individuals in terms of their income or social influence. And of course, the grades of intelligence were largely informed by sort of the shapes of people's heads that many people felt put an upper limit on sort of the higher order thinking abilities of certain kinds of individuals. And I'm sorry to say, a lot of these ideas that were rooted in phrenology, which has long been dismissed, are still around today. So we can't necessarily say that, as laughable as these ideas of phrenology were, they're not pernicious and they're not pervasive and persistent. So we have to recognize that as neuroscientists, we do bear a particular duty to make sure that we're doing a great job, not just in terms of overall fidelity of our work, but also making sure that we are very deeply engaged with the community about our work, because when left to our own devices, we try to create an understanding of the brain that fits the world around us, rather than taking cues from the world around us to push our science forward. So that kind of gives rise to a really hard question. How do we as neuroscientists not be evil? How do we do that? Because again, if we just talk to each other, we just talk amongst ourselves and whisper in our corners at our conferences, we end up doing pretty nefarious stuff. So there's a really good reason to sort of think about engaging with the public, engaging with communities, not just in order to have a certain kind of sample, but to make sure that the questions that we're asking are reasonable, they're effective, and they're ethical. So fast forward, a century or two, and we're moving past the kind of the world of phrenology to what we're going to be talking about, or at least we'll be anchoring a lot of our work, sort of standard fixed magnetic resonance imaging, or MRI. So when you think of having an MRI, whether we're talking about a brain or a knee or a hip, we usually think of a device that looks a bit like this, and we usually think about it being deployed in a setting that looks a lot like this one. What I think is an exciting to realize is that we are moving in an age where MRI is starting to take on new characteristics. It doesn't look the way that it looks the way that it used to. So this is a picture that Professor Shen took of me just a couple of weeks ago. So in the back on the left, you can see an old fixed MRI machine. And then standing next to what I'm standing next to is a new, highly portable version of neuroimaging, which is going to be sort of representative of the future, where you have a device that is mobile, that is movable. And as you can see from that beautifully comfortable orange chair, it's a little bit more comfortable than what we're used to. But that's not the only way that we're thinking about new technologies of imaging the human brain. This is one of the famous hyperfine scanners. So those of you who know or have heard of portable neuroimaging might have seen that a device like this hyperfine scanner can easily fit in the back of a van. You can see here that most of the back of the van is filled with the bed for the patient to lie on, and the same kind of batteries that power my snowblower. So what we have here is a recognition that neuroimaging technology is going to be taking off in new directions. And in this case, quite literally, because again, it could be operated in a van that doesn't need to be plugged into any sort of mains or any other additional sources. The device effectively runs off between 2 and 4 of those snowblower batteries. And then, of course, we've got one of the key subjects of the studies that we're leading today for the Reach for Brain study, which is called the Connectome 2 scanner, which was initially designed and originally built by my colleague over here on the left, Susie Huang, and you can see Professor Shen is there as well. And we have to recognize here that if we have more mobility with the traditional fixed MR, sorts of sequences and runs that can be done in a lot of new environments, we can now go back and think about those standard fixed MRI setups, and we can start to see sort of the increased fidelity. So these top images, when you kind of compare them, the 0.76 millimeter versus the traditional 1.5, you can see that we have a lot greater range and understanding and detail of what we can map in the brain. And so all of this might be really, really exciting. However, you might be thinking, gosh, how do we make sure that we don't use this for evil? How do we make sure that we're not necessarily taking these highly portable, these new cutting edge technologies, and how do we avoid building a new phrenology of what you see here of a young millennial woman, for example? So when we think about that, we need to recognize that including a wide variety, a wide chorus of voices in our research is really critical. And without it, as you can see, as I showed in the examples before, it destabilizes the science and the work that we do. It makes it hard to continue on. So as I'm sure most people know, if you have a biased sample, it threatens your external validity. You're not able to generalize your sample. But it turns out that when you don't have the considerations of a broad set of voices, when you aren't present with the public and the community in doing and motivating your work, there are compromises to basically all aspects of validity that undermines causal estimation in most human subject research. So it's not just about generalizing, it's really about kind of creating a strong, rigorous science. And so normally, you would say here, well, we've got to reach out to, these groups that are underserved and that aren't normally reached. And we now have a pair of executive orders that were released on January 20th and 21st of this year that have led to some changes in how we think about the traditional approach to reaching a wide chorus of individuals, a broad set of folks. And so because we are not necessarily going to be approaching the work in the same way, we need to be thinking about looking upstream for solutions. So typically when we think about group differences, especially group differences that we think about the scientists without considering the community, we often kind of break them into two categories. We sort of say there are biological disparities, there are differences between someone who looks like me versus someone who doesn't look like me, and it's part of our DNA, it's part of our hardware of our bodies. Other people might say there's a difference between me and someone who doesn't look like me because of social factors. There are social and structural inequities that are either built or reinforced at the level of whole societies that really undermine those differences. Now, what I'm recommending today is instead of just thinking about differences from either out there as a social factor or inside here as a biological factor, that we as scientists might need to be a little bit more thoughtful about some of the factors that may be influencing our science. So we might think about aspects of selection, aspects of measurement, aspects of implementation and design, instead of just thinking about structures and biological facets that may be powering the differences that we observe in our neuroscience research. And so what's great about this, and something that was hinted at if you saw any of the advertised posters for this particular talk, is that when we are thinking about these solutions from an upstream perspective, to be more thoughtful, to be more expansive in who we're incorporating into our research, there are well-known, well-studied, well-validated phenomena that can help us sort of build a scaffolding onto some of these different sort of solutions. So if you're worried about who's coming into your research studies, you might think about some of these factors that are listed under selection bias. If you're worried about how you're measuring things for those particular groups, you might think about some of these facets and factors that are already modeled here under measurement error. And then, of course, the assumption is that let's say that you are really determined to demonstrate a biological disparity. This particular workflow suggests that you need to make sure that you have corrected and ensure that there are no inherent or built-in or overlooked differences in terms of selection, measurement, implementation, in terms of social and structural inequities. And then if you can assign variance to all of those things, move them aside, whatever group differences remain may potentially be attributed to biological disparities. So instead of just sort of saying, that men are from Mars and women are from Venus, let's take a look at some of these other factors that contribute before we kind of jump to those conclusions. What's great is that not only do we have a way of citing and understanding some of those sources of bias or error, but we additionally have a very clear set of solutions that are also very well mapped onto these same sources of potential bias and error. So in terms of just giving you quick examples, in terms of thinking about, say, something like selection, you can take one of the things that we are developing and advancing within Reach for Brain is using GIS mapping to understand where populations are, especially populations that may be at a particular risk of a particular disorder, and using this as a way of trying to understand where you need to be doing your outreach, whether it's in terms of engagement, whether it's in terms of recruitment, whether it's in terms of long-term retention to a clinical research study that you might be conducting. This one is looking at a particular risk that may be involved in risk for Alzheimer's disease or Parkinson's disease in particular. So some sort of dementia that may be associated with neurodegenerative disease. And so what you can do is you can map that and really consider this while you're designing your study and thinking about it proactively. So we used a version of this in a study that we started running many years ago, where we found that, compared to baseline, just being oriented to these differences, just being aware of them, as you can see in the control condition, substantially improved representative of it improved representation of groups that were historically completely overlooked and forgotten from the study. When you actually conducted an intervention, when you considered things like these geospatial maps and other related factors, you could see that a rising tide really lifts all boats. So even if you were, particularly focused on, say, non-white populations, it turns out that by designing a study that focused on that group, you also brought in individuals that were relatively low income, relatively low education, that did identify as white. So when it comes to thinking about concerns related to measurement, this is taken from an ongoing study that is looking at pragmatic design. So we're moving well beyond the world of traditional fixed MRI that takes place at an academic center, and thinking about pragmatic designs of studies that are being conducted in the wild, which now can be done thanks to portable MRI. You've got a traditional source of metrics that helps you understand the variance that may be coming into your study, but you can also create a set of equity or equity-related measures that help you understand who's going to be coming in, who is contributing, and who is participating. So thanks to these equity measures, in this particular study that's looking, again, at dementia, specifically Alzheimer's disease, we also use these equity metrics to help us understand building in what was called a lived experience panel. So these were individuals who were either caregivers, care partners, or individuals who were living with dementia that had a really powerful position of helping us understand what we were measuring, how we were measuring it, and ensuring that we were thinking about these problems the right way, instead of just, again, a scientist talking to scientists about these matters. Now, beyond selection and measurement, we've also got implementation. And so what you can do is there are lots and lots of ways you can think about incorporating the voices of patients, of families, of neighborhoods, and of communities at multiple stages of our study design, so that we can make sure that their voices are really, really present in the work that we're doing, not just as research participants, but really as co-design partners in our study. And so what this means is, if you think very carefully about some of these factors, if you think about selection and implementation, if you think about measurement error, we can recognize that studies that tend to rely on trying to identify groups in terms of recruitment or study differences as a function of race, which again is it's getting harder and harder to do these days. We recognize that because race is usually used for one of these three reasons, either for dimension reduction, either as a proxy for ancestry, or as a marker for racism, we know that these aren't really valid conditions. So there's not really a good reason, based on this workflow that I introduced in the previous slides, for using race in our studies. So instead of using something like race, which is troubling and problematic and, again, really difficult to do in the US these days, you should be thoughtful about your mechanism of action. And you can use this to help you motivate your work, whether you're doing recruitment, whether you're doing community engagement, or anything in between. It might be helpful and more, concrete to think about either using a broader set of group differentiators in your study, or something that we are doing within Reach for Brain is considering a much more robust, standardized set of socio-environmental factors. And so these are commonly referred to as common data elements. So you can use common data elements for a wide variety of things to really standardize the way that we start to look at this. But ultimately, this will give us a sort of a strong move in the direction of the quantified exposome. And so instead of thinking about social determinants of health, instead of thinking about some of those words that we're not allowed to talk about anymore in our research, we're thinking about social and societal and structural exposures, either in terms of things that you're exposed to at birth and things that you're exposed to as you grew up. To really understand some of these factors. And so instead of relying on something like race, which is a relatively poor proxy for these variables, you're looking for those specific factors themselves. And so, you can also think much more broadly. So instead of thinking about something like race, you might think, much more complex in your studies about sort of multi-level regression, moving even beyond sort of mixed effects models to like true hierarchical linear modeling and things of that nature. So we might think about why this stuff is really, really difficult. It turns out it doesn't really matter what your design looks like. It doesn't matter what you're looking at in the brain. If you are relying on people and you're finding it difficult to either recruit, you find it difficult to understand what people in your community are looking for, it's going to be one of these 11 reasons. And what I think is the way that this is often realized is when we do this community engagement work, you tend to find one of these two things. And so this represents two events that I participated in. These were two events in the same community of where I live right now in Boston. And they were both focused on brain health. One of these events had been running for many, many years. One of these events was only, was really running one time. And it turns out the event on the right was an event that had been running for many years that was revived, and it was done without community input. The one on the left was a direct response to what the community had requested. And so what you find is that when you design from the perspective of solving a need, and again, this is not just about community outreach, but in terms of the design of the central questions we're asking as neuroscientists, you tend to find that when you serve the needs of the public around you, they'll find you. They will show up. And so if you find that you end up with sort of a space in terms of your neuroimaging bay looks a little bit more like on the right than on the left, then ultimately this may be a problem of the way that you do your science. And so what we've did is we've taken those 11 reasons and we've kind of created an ordered workflow that sort of maps this triangle that I showed you just a little bit in a couple of slides earlier. And again, when I talk about reaching out to the community to try to really power your neuroscience research, what I mean is that we need to do a better job of understanding what those community needs are and reaching out to them on all of these dimensions that typically fall outside of the classic research protocol, which are just the 3 rows that are in green there. Everything else we tend to just sort of leave to people to figure out for themselves. And ultimately, that's what drives a lot of the differences that we see. I'll do one step just a little bit further is what we often see here is that when it comes to the recruitment rate over time, we tend to think that our research group, the research population that sort of comes to serve in our studies is just one group that's kind of comes in at sort of different sorts of times. Usually, though, the fact of the matter is that it's less likely to be one group that's sort of trickling in at different rates, rather than at least 3 distinct groups that kind of come in at different times. So you've got wave 1, and so you might think of those as like the early adopters. These are the people that are trying to look and seek you out and try to understand your research on your terms. They're not going to ask any questions. They just want to be part of the solution. And so when we design our neuroscience studies, we tend to design really only for wave 1, only for the people that are looking for us. When we put up those little tear strips, we'll put them, in our neuroimaging suite where only other neuroscientists or research participants or maybe a loved one will randomly see it. And we don't necessarily think about some of the other folks that might be nearby. So classic, or at least contemporary community engagement research will aim at this group, which is great. They're very representative. They're individuals who have certainly not been engaged in research previously. They can give us a lot of great ideas and really give us a lot of energy. But what we often overlook as researchers is we overlook this wave 2. So wave 2 is a group that is around. They're usually right in front of us, and they are just as eager as these early adopters in wave one. The only difference between wave one and wave two is that wave one folks will come looking for you. Wave two, they're ready to participate. They just need to be asked. And that it turns out that when it comes to engaging the community in our research, whether as research participants, whether as a community advisory board, most people are interested, they just haven't been asked. So very quickly, I'm going to wrap up here by offering just a little bit of advice. Really be thoughtful about identifying what matters for your research question. If you're going to reach out to a new group, you have to do new types of things. Really focus on this awareness problem. And you see these sort of this bullet point right here. If you are doing neuroimaging research or neuroscientific research, do your parents know what you do? Do your kids know what you do? Do your roommates know what you do? The answer is probably no. And again, these are people who are the most invested and most likely to kind of spontaneously care about your work. If you can sort of get your message out beyond those folks, then that's a great step. Things that we need to really be thoughtful about is offering the message to other people, clinician champions, community ambassadors, research ambassadors, who might be able to sort of take the message using plain language and deliver it to people on your behalf. If you ensure that you can have a strong return of value, usually that's codified in terms of money, time, and information. If you can give somebody all three of those, they're much more likely to want to hang around. If you can only give them one, you're going to have to work a little bit harder. So same community entrenchment in terms of having folks magically come to you from all walks of life. It does work, but it takes a lot of time, usually more time than we have when it comes to our particular studies. So we've got to really be thoughtful and sustain in our efforts. This is where it helps to work at the level of an institution or at the level of a department rather than at the level of a single protocol. So I'll stop there. What I would like to do is sort of stop with all of like the numbers and kind of the basic advice. And I will turn things over to my colleague, Helen Hemley, who will give you a really quick preview of a super innovative way of engaging the community and the public in our neuroscience project, Reach for Brain. Okay, so I'll turn things over to Helen.
Thanks, Jonathan. I realize my slides have far fewer GIFs than yours, so maybe less fun, but thanks everyone. So I'm going to talk about an innovation that we've introduced to engaging community in not only getting people out and to go to events about research, but also to be a part of research as change agents. So that is called theories of change and outcome maps. These are not concepts that were designed by Crescent or by clinical researchers, but are very prevalent in nonprofit and public health spaces. And so what we've done is taken them into clinical research settings to try to engage communities that haven't been part of research design. So in 2021, I received a PCORI Award to do this work with Black and African American communities in the greater Boston area. And so the quotes that you see throughout my slides are taken directly from those meetings where we had 12 folks who are leaders within their communities come together and build theory of change and outcome map for clinical research in general. We're now taking that, a subset of that group and bringing it into Reach for Brain to talk about engagement with neurodegenerative clinical research specifically, still in the greater Boston area, but expanding to be across other BIPOC communities, Black, Indigenous, people of color communities. And then we're also have taken this format and are doing a project with Duke to specifically engage around sickle cell research across the country. So again, I think this quote is very powerful. Not that people don't want to engage, but that people are not welcome to engage because they're not coming in knowing the history, knowing the way that we're trying. The community itself is engaging with the research institution. So in Boston, there are many large research institutions. They are all, or most of them are right border the neighborhoods that have been historically Black and African American, although that is changing rather rapidly, but even though they are abutting those neighborhoods, they haven't had a lot of engagement with those neighborhoods. So when communities are asked to be a part of research, it's kind of the researcher has the perception of dropping in and then leaving. And one of the reasons that I thought that this approach would be really interesting is because one of the studies I had worked on historically was looking at engaging gay and lesbian individuals. I'm from a town called Provincetown. And so I was saying, oh, you should do this, you should do this to engage those people to get them to want to give their data to the study. And even though I'm from that community, it was not really listened to. And they didn't actually recruit there at all. So, although I think a lot of people would have wanted to. And so, a lot of times, people who are from the communities that researchers say they want to engage are not really reached out to when it comes to, as Jonathan said, designing these studies, even though you can get really valuable knowledge in how to directly connect with communities. So, what you normally see in a research study, as Jonathan said, was it will be, a poster that has a lot of information. It's not written at a level that most people can engage with, or it has abbreviations or acronyms that don't mean much to people. But what we've done at Crescent, and this is you see on the right, a poster that we helped design for the same study, is really try to humanize the research process and provide sometimes more information, that means more text, but really at a way that can reach the individual and personalize the research experience for them. So by doing that, again, this is a quote from that same group. We're trying to not just show up for the ask, but really to build a consistent presence in the communities that we are hoping to engage. So even though there was a bit of a gap in time between the group that I engaged for that initial PCORI award, I stayed in contact with them throughout the process. I let them know what was being done when I was publishing papers, when we were putting in the awards for additional funding, which we then finally got, so that they would stay engaged with the process and not have me, say, okay, this project is over. Now 2 years have gone by, you haven't heard from me at all. A paper went out, you didn't even know about that. And now I'm asking you to be a part of this again. So by staying really vigilant and engaged with that group, even if I didn't have new ways to give them money or recognition for their work at that specific time. I was still making them more willing to say yes to engage in this future project. And I think about 2/3 of the group that we have right now for the Reach for Brain project are from that original group. So through this award, we were trying to address inequity in clinical research with Black and African American communities by creating this theory of change and outcome map to really have tools to directly show researchers how these communities wanted to be engaged in the research that they're doing moving forward. And so the way that we selected these individuals was through a public health model. So instead of trying to say, okay, I know so and so, I want them to come to this research group, really trying to see, does this person have the time? Do they have the knowledge? Do they have the interest in being a part of this group? So really trying to say, who are the right people for this group rather than who are the people that I know who can be a part of this group. Because if you invite just the people that you know to be part of the group, that's great that you know so many people, but they might not give you the information you want. So an example that, I use a lot is if I'm putting together a study that's looking at, engaging folks in mental health research, engaging teens in mental health research. And I say, okay, I know this person from this church. I'm going to go to them and we'll give out flyers at the church because I know them and I've worked with them a lot. Okay, I go there, I give out flowers in the church, and everybody at the church is middle-aged or older. Okay, so I am not reaching the community that I want, even though I know this person. So we really want to try to find folks that would be engaged and be able to reach the communities that we're hoping to with this work. Additionally, we were trying to assess how by how adjacent people were to research and how knowledgeable they were to research, how that changed over the course of being a part of this. So we created this kind of tiers of engagement to understand if people became more interested and more willing to maybe not even be engaged in research themselves, but to promote and attend events in their community. Because if you don't have a lot of research knowledge, it's less likely that you're going to go out and seek that. But if you are building that knowledge, does that mean that you are going to go out and seek opportunities? Are you going to be more involved? As a result, are you going to promote research within your community? And I think overall we found, yes, that people did want to be more involved in research as the project went on. So we built a coalition of 12 folks. So this is kind of a abbreviated version of what that looked like, but we really tried to get people who self-identified as Black and African American, but also who were experts in their field. So getting people together not solely because of their background, their racial background or ethnic background, but because of their expertise, their background of expertise, so that we could look at the problem through a variety of different lenses and find the best ways to engage people within the community. So we had people from nursing backgrounds, we had people from clinical research backgrounds, of course, but we also had people who were advocates for youth and elders in their community. We had people who were in public schooling. We had people who were in public housing. We had people who were in LGBTQ advocacy, to really try to get the lens of, all the different things that touch on being a person living in the greater Boston community who identifies as Black and African American, and make sure that we have different perspectives and expertise at the table. So people weren't invited just because they were a leader in the community, but also because they had a specific set of knowledge as a leader in that community. And so the engagement process is really trying to identify those partners, review the assets of the community. Rather, a lot of times we focus on what the community is lacking rather than the assets they have to get out the word, to try to engage, especially around hard topics. And then to really drive that engagement. And ultimately, this project really focused on community ownership of what we built together. So in the paper that we published, the stakeholders were acknowledged, and also the community ownership guidelines that they put together were put there as well, to make sure that they are the central knowledge source. So what we really tried to do is to try to have the community be at the table, asking the questions and really driving the process. So I moderated the conversations, but it was really the stakeholders who put together the documents and all of the knowledge that resulted in the theory of change. So this is just a brief intro into it. It is a multi-page document that they put together, but really the goal was to transform the relationship between clinical research and institutions in Boston. So to take people from being tangentially associated with or aware of research or aware of community, and to really become change agents in the community and in research, having that bidirectional benefit. And this is the outcome map that the community put together to really drive that change process. So this took many different views over the time. And you can see that the community felt that it was really important for researchers to understand those systemic barriers before they can even start the process of becoming a change agent in the community. And so they also felt that evaluation was a strong component that needed to be done throughout. So that's why you see that at the bottom, where it's an iterative process. It should not feel like there's an end goal to it, but it's something that communities and researchers are constantly doing together and evaluating together if it works. And then this is a living document that can then be edited and changed as need be. And then, sorry, this is not showing well, but you can see that the stakeholder impressions, we did test them across the project, and they increased their trust. They had lower levels of mistrust and lower levels of disengagement with research as the project went on as well. So all of this to say is that the expertise that you're looking for how to get out into the community, for how to reach the hard to reach folks that aren't coming into your visits. It is there. It just may not be within the institution. It may be a group that you need to go out and motivate and say, we want to learn from you. And so that I will stop sharing, and I think we can open up to questions.
Great. Put both of you on the spotlight. And so we can open up to a small group. I think we can just ask people to unmute. Oh, hold on, let me put my off the spotlight. There we go. To either unmute or put your questions in the chat. I might start just to get things going, which is we've talked about this before, but it came up actually over the weekend at a conference, and the question is, when you go in depth with the group of 6, 12, 15, even if you expand it a little bit, and you work hard to get these different slices of the community, there's still just 15 or 12 people. How do you extrapolate into thinking about the larger community when you can't put the whole community in your stakeholder room or your stakeholder network?
Yeah, so I can talk about that first and then I'll pass it to Jonathan. So something that we're actually doing through Reach for Brain is taking those initial documents that I shared, and we're going to start bringing those out into the community more to get feedback. So we'll say, this was created by people who are from your community, but do you think this is right? Do you think there are things that we should change? And so by starting to expand slowly, you can get additional feedback. It's hard to get feedback from everybody, but you can create events, and especially highlighting events saying, this was created by you. This is what researchers are saying, like they want to use. Do you think this is right? That helps. Jonathan?
Yeah, and so Francis, you ask a really good question. If you really expand it out, let's say you've got 25 people that you're regularly engaging with, which is hard to do. Let's say you can manage to do that. That's still 25 when the size of the community that you want to reach might be measured in the thousands or tens or hundreds of thousands. And you have to remember that people will vote with their feet. The idea is that if you end up having some sort of presence in the community, whether you are trying to solicit more ideas, whether you're trying to disseminate information, whether you're trying to recruit or engage, if you follow the advice of the folks who you're talking to, if you really trust in them and it doesn't work out, then it's very clear that the ideas that you may have developed work only for a very limited subset, and in that case you might need to try again or go back to the drawing board. But if you can try these ideas, and again trusting in these individuals as experts, and you get a really great turnout, then that I think is a really great ringing endorsement of what it is that you found. So remember during my presentation when I had sort of those two events that I presented. So one of those was community informed, and one of those was sort of talking at the community. And even though they were both really timely messages, really good ideas, really thoughtful about what time of day to hold the event, it turns out that the one with the community input, they noticed and they showed up. So I think that you'll see the results really, really quickly, very rapidly, and usually beyond your expectations or the expectations of a typical neuroscience researcher, if you have truly tapped into kind of the community needs.
Thank you. Let's open it up. You can raise your Zoom hand. You can unmute. You can hit the chat. Are there questions from the audience about your own research, or might be interested to hear about your own experiences as well from the audience? I've got more questions if we need them, but jump in. All right, well, while you're warming up, let me ask one more question, which is, I think one of the conversations I've had with colleagues is it kind of goes like this. They're a new professor. They've worked, they've done all these things. They've done their postdoc and they've had to jump around. So they're in a new location that is not the place that they know well or that they grew up in. And they hear your presentation and they want to do this and they just really are overwhelmed and don't know where to start because they don't have a lot of local context. They just moved themselves. They're just trying to get established, but they like to reach out. Maybe their university doesn't have historically the greatest community and engagement experience, which certainly been, I think, the experience of many of us. What, what's the first step to kind of build up to what I feel is like, the level where you've just presented, like, or the first set of steps for someone who's in that position who doesn't have, those local ties to draw on?
Yeah, I'll jump in here. I think we gave this presentation, and I think, certainly during mine, I talked very fast and I was like, oh, you can do these like 19 things. And if if you don't work, then like listen to Helen. And Helen's method is very complex, especially if you've never done it before. So let me try to just break it down just a little bit so that people don't feel overwhelmed or bad. Let's think about whether you're a beginner, intermediate, or advanced. If you're a beginner, you might be listening to this talk, or you might be sitting looking at your own protocol. You're thinking, how can I get started? I want to do the right thing. I don't know how. Can you just like tell me how to do stuff? Can you just look at my materials and do it? If that is how you're feeling, then I would say the easiest solution for you to do is to try building some kind of equity into your study. And so I mentioned this very quickly during my talk. And so when I say equity, I don't mean in like the E and DEI. I really mean trying to make sure that you've got one of the following three things when you are approaching people, whether you're approaching people to talk about your study, whether you're approaching people to participate in your study, whether you're approaching people to disseminate your study. You need to have time, money, or information. And usually if you're early career, or if you're relatively low on funds like all of us are now, you want to start with time. It's usually some combination of time and information. And the easiest way to do that is to remember that as scientists, you're usually an expert on something. So I know a lot about the brain. I know a lot about neurodegenerative disease. I started off by just basically going and giving talks at every senior center that I could drive to in the state of Massachusetts. And that's where I got started. I didn't have a lot of money, didn't really have a connected network. I'm certainly not from Massachusetts. And so that was my first step. I started sharing time and information, and I built my network that way. And that was my first step. And so if you have no idea where to get started, start with what you know, start with what you have. If you don't have money, if you don't have a lot of time, find a way to share some kind of information about what it is that you do. Step two is you might be an intermediate. You might say, you know what, I tried doing some of this stuff and it just didn't work. I had a community advisory board and they were useless. You're like, I couldn't reach anybody. So if you're in that intermediate phase, then you need to be thoughtful about some of the other stuff that we talked about. So selection, you need to be thoughtful about measurement, implementation, or another way of thinking about implementation is like study burden. So change what you can to try to minimize some of these biases or factors. And if you have no idea what to change, just try to find one or two people that are local. They don't have to look the way that you want them to look. They don't have to speak a certain language. They just need to be local in local communities. And, find some people that you want to deliver your message and have them deliver it. Give them like 2 PowerPoint slides, and ask those individuals to also give you honest feedback about your study. And so usually you can find out, they'll give you a lot of information and you'll be like, I can't change most of these things, but I can change 1 or 2. And that's a really great place to kind of get your foot in the door and sort of move things along. You might be super advanced. You might be like Helen here, where you can say, I've had some success, but I keep reaching the same subset of people. I know this is a larger community. It really feels like I've saturated the network, or I've hit a dead end or something. In that case, the solution is very clearly Helen's theory of change process. And so that's published. It's really well developed and validated. Helen has deployed it in lots and lots of different ways, and it's very elastic and very robust. And so if you want to do that, then you really need to think much more broadly about who it is that you're trying to bring in, because you're probably, like Helen said in her talk, you're probably reaching out to like the same 5 or 10 people that you know from that community. While that's a great thing to do, you want to start asking sort of a broader subset of individuals. So putting all that together, as you kind of move from sort of beginner to advanced, you're basically sort of entrenching more and more power into local communities at an earlier and earlier stage of research design. And this is not just like a social justice activity. This is what you actually need to do to sort of supercharge your research to move it forward. Just like if you don't know a lot about statistics, you ask a biostatistician to help you. If you don't know a lot about community, you ask somebody from those communities to help you. And depending on sort of your ability and your reach, you can kind of start at this beginner phase where you're just like, I just need to dip a toe in the water and see where I can go. And then over time, you can scale up to some of these processes, like Helen explained in her very, very thoughtful talk. So hopefully that helps organize people just a little bit more, so that you don't feel like you have to jump in at the deep end.
That's really helpful. Thanks to both. Any other questions from the group before I invite our speakers to sort of say a few last words about next directions?
Yeah,
great. Colin,
one question.
Join us.
Yeah,
can you introduce yourself and kind of tell us where you were coming from? And
yeah, hi everybody. Wonderful talks, really helpful. I'm Colin Hoy. I'm a postdoc at UCSF doing Parkinson's and brain stimulation and mental health. Yeah, I guess I was going to ask, I really appreciate acknowledging that the funding environment is changing a little bit, focusing on upstream factors and trying to get to things that might correlate with variables of interest, but be a little bit more neutrally defined. Sounds great strategy. I was curious if also some of the language might need to change here. For example, equity means so many things, but has now been kind of roped into one particular usage. And yeah, I didn't know if you had any other words of wisdom. The funding question is always a big thing for trying to get some resources to dedicate towards this, but just maybe how to navigate how you talk about these things and make them, broadly appealing in the ways that we know they should be.
Helen, I did a lot of talking. Do you want to take this, or I can jump in?
Sure. I can take the first stab at it, and then Jonathan, maybe you can add more specifics for grant writing. I would say that I think that yes, that the language may need to shift at this time. I don't think that the spirit necessarily needs to shift at this time. So I think that you can keep doing this work and keep doing it well, and it doesn't have to be necessarily hidden, just changing the language around it. And Jonathan can give more specifics about that. But for example, we were doing our review of the enrollment table for Reach Your Brain, and we didn't actually take anybody's race or ethnicity when we enrolled them for this latest iteration of the stakeholder group. So we were able to put in, X amount of men, X amount of women into the enrollment table, and we didn't label it by race or ethnicity. And so I think that, as Jonathan said, taking race and ethnicity itself is problematic or controversial, and especially now at this time. And so, but for different reasons, obviously, than what Jonathan was saying. And I think that there are ways to do the work with the communities that you want to, and the community doesn't necessarily want themselves to be spotlit right now either. So you can work together to find ways to work with them, but not necessarily put a specific street under blast that you are door knocking on or things like that for ICE to do the same. Jonathan.
Yeah, so I'll try to give you 4 quick pieces of advice. Number 1, I think ChatGPT has recently released some sort of add-on that will highlight the kind of the dirty words in your grant, so you can kind of go and find them. So it'll, obviously you can upload your grant or your protocol and to kind of maybe highlight some of those words. So you might want to do that as a first pass. Second thing is that I believe that with the kind of the changes in the administrative priorities, it is still pretty easy to reach who you want to reach, and to write either euphemistically or from a perspective of kind of the mechanism of action to sort of to reach a particular group. And so I've been doing a lot of consultations lately, especially in the last 6 weeks or so, around very terrified postdocs who don't know how to reach their group, and they don't necessarily have like a lot in like, you know, they don't have like a great big slush fund that they can dip into to wear this, like weather this out over the last 4 years. So you know, what I would recommend, Colin, is reach out to us. I'll give you a free hour consultation. I'll show you exactly how easy this is to kind of do. And then the last thing that I'll say is actually very concrete, which is that if you actually look at how we write in our protocols and in our grants about things related to diversity, equity, inclusion, we tend to introduce them as prepositional phrases. You can just delete those prepositions, and it maintains the full meaning of your sentence without necessarily introducing the kind of like some of these dirty terms anymore. So I would say first pass, just get rid of those prepositional phrases, and it turns out that you can usually keep everything else.
Great question. Thanks, Colin. Thanks, Jonathan, and thanks, Helen, for a great session today. We're at time, but I want to just offer, in addition to thanking our panelists, thanking the NIH for supporting this work, thanking all of you for attending and thinking carefully about these issues. In terms of next steps, I put in the chat the link to Crescent Advising. I know that these conversations can go much more in-depth and can be more personalized, so please reach out to Crescent. If you're a trainee, please stay on the lookout for our Career Network newsletter. We hope to do some training opportunities in this space. We didn't get to reach that. Sort of, what do you do if you're still in college or postdoc or postbac or graduate student? You can take classes to learn new statistical methods. What can you do to sort of learn and train in these methods? So we'll try and address that as well. And of course, reach out to me if you're interested in Reach for Brain and all that we're doing. Thanks, everyone, and have a great week. Thanks again, Dr. Jackson. Thanks, Helen. Great to see you. Have a great day, everyone. Bye.